Etiology. Etiology is the cause or causes of a certain disease or condition. What is rabies? According to Mayo Clinic 2021, rabies is an intense viral disease in which a person's nervous system is attacked. There are 3 different types of rabies. Furious rabies, where your body lashes out and you lose most motor control and you foam at the mouth. Paralytic. Paralytic rabies is a more specific type where your body slowly shuts down. And lastly, atypical rabies. This is most associated with bat bites and can often be confused with both furious and paralytic rabies because it has symptoms of both. How can it spread? According to the WHO 2024, dog bites and scratches are the main cause of rabies in humans. It is important to get any household pet a rabies shot to keep both you and your family safe from this deadly disease. In some very unlikely cases, the disease can also be spread through transplantation of organs or tissues. Mayo Clinic 2021.
The signs of rabies are included but not limited to fever, tiredness, headaches, anxiety, irritability, seizures, confusion, hyperactivity, which is feeling restless and always wanting to do something, hallucinations, where you see, hear, smell, or taste something but only exists in your mind, strange behavior, and foaming at the mouth. The symptoms of rabies are again included but not limited to insomnia, which is trouble falling asleep, staying asleep, or getting good quality sleep, confusion, agitation, where you're feeling tense and get easily annoyed, delirium, which is episodes of confusion, hallucinations, hydrophobia, which is a fear of water, and hypersalivation, where your body produces a lot of excess saliva. The Government of Canada website states that the signs are more regular every day, so the ones that are more common to specifically rabies is hyperactivity, hallucinations, strange behavior, and foaming at the mouth. And CDC states that their symptoms are insomnia, confusion, agitation, delirium, hallucinations, a fear of water, which is hydrophobia, and hypersalivation.
What is prognosis? Prognosis, as defined by Cleveland Clinic, is a likely outcome of a disease, injury, or illness. It determines how likely you are to recover and predicts the likely outcome of your condition over a set period of time. The prognosis of rabies is quite simple, really. Within about 3 to 10 days after the symptoms appear, fatality is very common. The 3 stages of rabies virus is incubation, prodromal, and acute. In the incubation phase, it can last about 60 to 90 days, but can also vary depending on host and viral factors. It is usually the first sign of symptoms, which can be fevers, headaches, and tinglings of point of contact. Prodromal usually lasts 10 days, and symptoms can vary wildly in type, from fever, itching, tingling/burning, fatigue, and more. The acute phase usually lasts from 2 to 10 days, and almost always ends in death.
Risk factors. Anyone can contract rabies if they are bitten by an animal who is infected or exposed to a rabid animal's saliva and they don't seek medical attention right away. According to Canada Health 2025, people who are most at risk for contracting rabies are children because they are more likely to interact with or be bitten by animals, veterinarian staff, animal control officers, and people who go cave exploring or travel to countries where rabies is widespread. People living in underdeveloped countries are more at risk for contracting rabies since there is less readily available health access to help those who have been exposed. Rabies is most prominent in Asia and Africa and is accounted for 95% of rabies deaths per year. Solomon et al., 2017. Diagnosis. It is extremely hard to diagnose rabies before symptoms arise, and unfortunately, once symptoms have emerged, it is already too late. Rabies is almost 100% fatal after symptoms are present, and most tests that can be done to determine for sure if a patient has rabies are done post-mortem, which means that unfortunately we cannot diagnose rabies until it is too late for the patient. There is still not a lot of information out there about diagnosing rabies, but if it is presumed that you have come in contact with the rabies virus, doctors will send you for many tests and will recommend treatment right away to try and get in front of the rabies virus before symptoms can occur. There are some tests that may be done ante-mortem to try and determine if you have contracted rabies. 1. Lumbar puncture. This is when the doctor tests the patient's spinal fluid. 2. Skin biopsies. This is when the doctor takes a sample of the patient's skin near the site of the bite and they see if the rabies antigens are present. 3. Saliva/blood tests. Doctors may take a sample of your saliva or blood to test to see if the antibodies are present in the patient's saliva or blood. 4. Imaging tests. A doctor may send a patient for imaging tests to see if there is inflammation in the brain, which is a sign of a rabies infection. Wong, 2024. With these tests, doctors may be able to detect the proteins on the surface of the rabies virus. Medical Centric, 2021. This will hopefully give them enough time to get ahead of the virus.
Treatments available. It is crucial to begin treatment as soon as possible when you have been infected with the virus. Most times, rabies can be hard to treat. However, in some cases, not impossible. When freshly infected with the rabies disease, according to Mayo Clinic 2021, you can receive a fast-acting shot to prevent the disease from further infecting your tissues and internal organs. If you are aware that the animal that has bit you has or could have rabies, getting to a hospital is the most important thing you can do. However, if the animal that has bitten you cannot be found, it is safest to assume that the animal has rabies, and again, getting to a hospital is the most important thing to prevent the disease from continuing. Taken from the Government of Canada, 2023, if you have been bitten by a rabies-infested animal and have not had the previous rabies vaccine, you will have 4 injections of the vaccine over 2 weeks or 14 days. However, if you have previously gotten the vaccine, only 2 injections over 3 days is required.